to improve healing, to improve the pain, A delta fibers, C fibers, firing of these fibers to control the pain, which is possible through IFT only. What is IFT? IFT is the interferential therapy to reduce pain. There are two medium frequency currents are used, suppose 3900 Hz and 4000 Hz, where these two frequencies currents are interfering. A low frequency current is generated, which is easily penetrable to our skin, to our tissues. Mid frequency currents which interfere a beat frequency, which we can calculate by 4000 Hz minus 3900 Hz to give a beat frequency of 100 Hz, which penetrates easily through our body to stimulate the muscles, to improve healing, to improve the pain, A delta fibers, C fibers, firing of these fibers to control the pain, which is possible through IFT only. IFT can be used low back pain, in knee pain, in spondylosis, reducing the swelling, which is very effective. The contraindications, like we cannot use it people who are having pacemakers, pregnant, malignancy, any kind of hemorrhage. In these conditions, we should try to avoid IFT because it can cause some kind of ill effect. So it's very important to know the indications and the contraindications of like IFT. Along with that, there are various frequencies in which IFT can be used. Focus on a larger area, suppose a back we are treating, we'll always try to use the IFT in a vector mode. There are two frequencies which can be selected. Suppose it is 100 Hz and at the same time 50 Hz. If we want to swipe between two, for 6 seconds 100 Hz would be on, and for 6 seconds again 50 Hz would be on. So we can switch over to prevent the adaptation in the muscles. We can also use sweep frequency. Like in sweep modes, there can be different like graphs which can be forming, rectangular form, or it can be a trapezoidal form as well. Different modes can be selected, like in case of sweep frequency, which is another advantage of IFT, which is not possible in other modalities. The two currents interfere, and where the pain is, that should be at the center, and the 4 pads should be placed crisscrossed like this. Suppose the 2 pads, we keep it like this, and the other 2 pads would be along this line, diagonal. So where they intersect, there the maximum pain which needs to be relieved through IFT, the pad should be accordingly placed. So that's the reason we need a qualified physical therapist to treat a patient with IFT. To learn the different like modalities like IFT, ultrasound and all, we always try to rely on qualified physical therapists who know the indication, contraindication, and how to use it, the different modes which can benefit the patient in different conditions that we have. That is the reason IFT is very effective, provided we get it done by a qualified physical therapist. So find out a qualified physical therapist in your area and get it done only through a qualified physical therapist to reap the maximum benefits of IFT.